Yeah,
And then COVID hit. So it wasn't the other way
right.
around. Like for me, it
No,
was the other way around.
no, I was well prepared to focus on COVID already because of
Wow.
I was already deep into the literature, following the science, learning how to read scientific studies
What a blessing.
on medical issues. So it was just kind of a natural. I just fell into that immediately because it was just already I was already focused on health freedom because my son was born in 2012, and it was a number of years of intense research before I felt
Hmm.
comfortable speaking out about this issue. Because of course, I knew as soon as I did, I was placing a target on my back, and so I had to kind of gain the level of knowledge for me to have the confidence to be able to speak out and express my views publicly. For obvious reasons, I think
Sure.
that's a huge challenge for anyone. Um, and so I
It-
understand when I try to encourage other people to speak out, I
yeah.
understand the hesitancy to do that because, of course, you're going to be labeled. But now it's become easier, I think, because I was an anti-vaxxer before it was cool, and I
Right.
use that. I use that label. I reject the label, of course. I'm not an anti-vaxxer. I'm not anti-vaccine. But Merriam-Webster has actually helped make it easier on us because Merriam-Webster actually defines an anti-vaxxer as somebody who supports the right to informed consent. So yeah, I guess in that sense, by the dictionary
Okay.
definition, I,
Right.
I support the right to informed consent.
Yeah.
I mean, other parents might make different choices, but anyhow, yeah. To come back to that question, so yes, I was already very much deeply. Um, I had deeply researched it, but it was a number of years before I started writing about it. And so when I say around 2017, 2018, I think by 2018, that's pretty much all I was doing was writing about the vaccine issue and how public health policy systematically violates the right to informed consent. And that was my
Yeah.
issue. And also just my own experience dealing with doctors' ignorance, their condescension, their
And-
arrogance, their
yeah. And
lack of knowledge.
when you talk about public policy, are you specifically talking about like the idea that pharmaceutical companies can't be sued if something under the auspices of a vaccine?
Sure.
Policies like that.
Yes, that's part of it. The legal immunity, the lack of a free market. I mean,
Right.
if we had a free market in healthcare, none of this would even exist.
That's right.
Because yes, the vaccine industry was essentially saved by government legislation in the mid '80s that granted broad legal immunity to the manufacturers against vaccine injury lawsuits.
Eh,
And so that's a huge part of it. Yes, absolutely. And just the more you understand about how the system works, and you have these federal agencies, the FDA, the CDC, and we're told that they serve public health. But I'm sorry, public health is not their job. They're
yeah.
not into public health. They serve the pharmaceutical industry.
That's
Period.
right.
And this is easy to demonstrate. Simply ask yourself the question. Look at COVID, and look at the vaccines. And this is true of any vaccine. But look at what their policy was. It's a simple question. It's a simple question. Was the CD's policy to provide people with the information that they needed to make an informed choice about whether to get the COVID vaccines? Or was the CDC's policy to achieve a high vaccination rate?
It,
Which
obviously,
was
number
it?
two. Obviously,
It
number
was
two.
number two. So
Yeah.
therefore, the CDC were
Yeah.
not interested in public health. They were interested in serving the pharmaceutical industry. It's
Right.
simple. It's
Right.
basic logic.
And
They
and I
don't serve public health.
and I think the fallacy that a lot of people could easily fall into is then what we need to do is we need to set up another organization to that maybe we get rid of the CDC, but we need to have something to help regulate and keep these pharmacy companies from putting out poisons into the world. And the fact is, like, that will get captured too. Like
Sure.
that it will get captured just like the CDC. And the only real answer over the long term is a free market system, a
Yes.
truly free market system that
Yes.
allows for profit and loss and companies to go bad and
Yes.
people to go to jail for fraud.
Yes. That's right. Because if you look at all the complaints that people have about how violative the industry is, it's well, how is it that the pharmaceutical industry has such power and influence? It's precisely because they don't operate in a free market. It's
Right.
precisely because they leverage the use of government force.
Right.
It's the same with the central banks.
Yep.
The Federal Reserve. We need a free market. The Federal Reserve is a government legislated monopoly on the supply of currency.
That's right.
How central banks could not exist in a free market.
Right.
And what is the purpose? What is the function of a central bank? It's to effect an upward transfer of wealth from we, the masses, the poor and the middle class, to the top 1%.
That's exactly.
That is the purpose of central banking.
I had a conversation with somebody just the other day, about, we talk about the what are they called? The CDCs, the Bitcoin for central banks. I can't remember the exact term for it, but
Yeah,
basically,
central bank digital currency.
there you go.
Yep, DC.
CBDCs. Yeah. And how they're terrible. And while I agree they're terrible, and that just would it will just accelerate the theft. It's really, we have that right now. I mean, that is what the dollar is. A dollar is a manipulated instrument that decides who is rich and who is poor. And until we have the ability or take the ability to own our own money, it's not going to change. And I don't know if the answer is Bitcoin or gold, but at some point we have to take control and own our own money, because otherwise it is a huge scandal, or a huge ring of bosses that are it's exactly what Occupy Wall Street was fighting against, back in the early 2000s. Is we are the 99%. Well, yeah. And they want to keep you the serfs.
The idea of central planning an economy is
Yes.
so logically ludicrous. And what people don't understand, there's this reactionary, people think of free market as they react to that term.
Right.
Like the free market is some kind of evil idea. And they don't understand, there is no, and then they talk about how wonderful democracy is. Well, there is no more perfect manifestation of democratic principles than the free market.
Yeah.
When people are engaging in voluntary exchange for mutual benefit. And this ties right into the pricing system, and how prices are absolutely essential for efficiently allocating scarce resources toward productive ends, as determined by the will of consumers.
Yeah.
You can't get more perfect democracy than that system. The free market is the perfect democratic system.